Hello everyone, I'm Dr. Lavanya Aribandi. I'm a physician trained in internal medicine and I'm certified by American Board of Internal Medicine. Today I'm going to talk about COVID-19 virus, how we can prevent its spread, how we can avoid infection in ourselves and contain this virus so that it doesn't spread further in our community in India. So, as we all know, I will not go into details of how the virus spread has started. As we all know, it started in wet supermarkets of China where meat is being sold. Some of the workers from there, they had pneumonia cases. And when health workers noticed that increase in pneumonia cases, they have reported to World Health Organization. And on further testing and further probing, it is found out that this new virus, coronavirus 19, COVID 19, is causing this infection, causing the infection and leading to pneumonia in these cases. As you already might be knowing, coronavirus is not new to us. We have had infections with similar kinds of coronavirus in the past. We called it SARS and MERS in 2003 and 2012. Now, this is another strain of coronavirus, and we are calling it COVID-19 at this point. Now, with this very brief information about how it started, let's look at some of the numbers. As we all know, 4 countries are having maximum number of cases. The total number over the globe has increased to more than 1.1 lakhs, more than 1,10,000, and a little bit more. But most of the cases have been in 4 countries: China, Republic of Korea, Italy, Iran, and of course in a lot of other countries the infection is there. It's just the number of cases are more in these 4 countries. The coronavirus has been spreading fast. That's not a good news. The number of infections, once few infections started, if we don't take aggressive measures to contain the infection, if we don't take preventive measures in individuals and as a community, it is spreading very fast. That's the bad news. But there is also one good news. The mortality, the death rate of coronavirus is not as high as previous infections like SARS or MERS. If you take in China, it was about 2 to 4%. In other countries, it is not even that much. And most of the deaths have been in elderly people who are above 50 years of age. So if you're a young person, the chance of severely getting infected, severity of the medical issues in you is very less. But that said, it's not just about the deaths. It is about containing this virus, because in our society we have vulnerable people. Any pandemic, every country, all over the globe, we need to contain any kind of pandemic, including COVID-19, so that it doesn't spread and becomes a big menace to healthcare system. Doctors are overwhelmed, a number of admissions go up, number of severe cases go up, and more importantly, we have elderly people, pregnant women, people who have chronic conditions who will get affected severely. So at this stage, containing the virus has been the prime priority for all of us. And we'll take a little bit, we'll discuss about the scenario in India. At this point, though initially it was kind of slow, now as per the website of Ministry of Health and Family Welfare, at this point we are having detected cases, 52 detected cases. Of these, about 16 are foreign nationals and about 36 are Indian nationals. Though 52 is actually not a big number, but the concerning thing is that number of cases have been increasing. Steadily, we have been getting a new diagnosis of these COVID-19. If you take in China, the number of new diagnoses compared to before, they have been declining. That's a very good news. That means they are successfully able to control to some extent about the spread of coronavirus. Whereas in India at this point, we are having a slight increase in numbers. Every day we are having new diagnosis of coronavirus. And initially, we did talk about how fast it spreads from human to human. Usually, if one person infects one person, the epidemic, the pandemic, grows at a steady level. Whereas COVID-19, is infecting more than 2 people at this point. So that means the pandemic, there is a chance that it will increase in numbers. So our responsibility is to contain these numbers. And it is not just the viral behavior, it is about the precautions we take in society that determines how many people will get infected. If you take the example of the ship that had coronavirus infection, there each person that is infected with corona infected 15 other people. So, on an average, and for other various lack of preventive measures, it has spread to from one person to 15 people. So, what it tells us is it is not just the virus behavior; it is about the precautions we take in containing the virus that determines how fast or how many cases we will have, how fast the spread will be, and how many cases we will have in India. So our main goal today is not to panic because death rates are very low and number of cases in India are not that high at this point. The second goal is to still, while not panicking, still take all the measures because we know the importance of containing this virus. We know how fast it spreads. So we still have to take all the measures that will prevent further spread of this virus. Now, how do we prevent the spread? Before we go to that, let's talk about the symptoms of coronavirus so that we have some basic understanding about how it affects and then go to prevention of spread. If you take typical symptoms, the most usual symptoms are fever, cough, which is most of the times it is dry cough, and malaise, body aches, feeling worn down. These are the common symptoms. But there are some other symptoms. Sometimes few people may present with shortness of breath. Very few people may have gastrointestinal symptoms like vomiting. So these are, and few people may have headache. While we say fever, dry cough, and malaise are the common symptoms, sometimes cough can be wet, sometimes there may not be fever, sometimes they can present without fever and with vomiting or headache or shortness of breath. Though these are not very common scenarios. Common scenarios are fever, dry cough, and malaise. These are the common scenarios with any combination. Now, when a person who is infected with COVID 19 coughs or talks, these droplets from his mouth, these droplets are spread onto the surfaces around him or her. And these droplets can stay for hours on those surfaces. Unless that those surfaces are properly cleaned, they can stay for a long time on these surfaces. The period can be anywhere between 6 hours to 12 hours, or even slightly longer than that. Because of this, if a person who is affected is coughing or is emitting droplets, and another person comes and touches those same surfaces, first of all, his hands are contaminated, and if he touches his face, the mucous membranes come in contact with this virus, mucous membranes of eyes, nose, or mouth, and this person is infected with COVID 19. So droplet spread is the main route of transmission. And when we talk about droplet spread, naturally, when a sick person is coughing and having virus, his fomites, his clothes will have deposition of the virus. We need to understand that. And wherever he is walking around or wherever he is spending time, he is probably just leaving those droplets. Now, what are the precautions this person who is affected with these kind of symptoms need to take at this point? At this point in India, because we don't have that many cases, not every person who has fever or dry cough need to rush to the hospital or get it tested for COVID 19 because they are most likely probably are having common cold or influenza-like illness because we are still having flu-like illnesses this time of the year. So every person who is having cough and fever may not be having that, but still following the precautions for prevention of spread of COVID-19 will also prevent the spread of common cold viruses and influenza. So it is advisable to follow the precautions anyway. While we say we don't need to rush to the hospital, I will tell you when a person with symptoms need to go get it checked in a minute. So the first thing is sick person may have the symptoms that I mentioned. Second thing is every person who is having these symptoms may not be having infection with coronavirus. And the third thing is this person who is having infection is spreading infection actively through his droplets. Now, we were talking about the responsibility of this person who is sick. He or she has certain responsibilities towards the community and towards the family members so that virus is not spread to them. Now, the first thing is he needs to wash his or her hands frequently. These people who are sick need to wash their hands frequently. Hands will have this droplet deposition because it's our habit to touch our face, how much ever we try to not do that. So, wash your hands frequently if you have any of the respiratory symptoms, very frequently. And if you don't have access to water and soap, have a hand sanitizer. Sanitize your hands frequently. And washing is thorough washing, not just a few seconds of just washing your palmar surfaces. Wash on the palmar surfaces, dorsal surfaces, between the fingers, knuckles, and wrist areas, and near the nails. Wash properly, spending few seconds with soap and water. And in case if you don't have, use hand sanitizer. This is the first precaution a sick person should take to prevent the spread. The second precaution is that wear a mask. Wear a mask so that you don't spread these droplets to all the surfaces around you. And when you wear a mask, make sure it is snugly fit around your nose and mouth. There is a white metal strip on most of the surgical masks, on all the surgical masks. When you wear it, make sure you press it around the nose in this area so that it is snugly fit around your nose. And then put the tags behind your ear or tie it. The top knot should be little tight, and the lower two strings can be tied slightly looser. Once you do that, spread the mask around your face so that it covers the mouth. And your responsibility doesn't end there. Don't meddle with the mask often or remove the mask, keep talking and put it back. Many people have that habit because it's slightly uncomfortable. The main point you need to understand is once you wear the mask, until it becomes damp or you want to change the mask because you're uncomfortable, it may be 3 hours, 4 hours, 5 hours. There is no right period for this duration of wearing of the mask. Until you are ready to dispose it off, do not touch the mask. And when you are disposing it off, remove the mask from behind the ears without touching the actual mask area. Dispose it off very carefully into the trash can. If you touch the surfaces, especially the inside surface, even outside surface, there may be a chance that uh, um, definitely when you touch inside surface, you're touching the droplets with your hand, and then with the same hands, you're doing other things. So don't touch the mask, dispose it off carefully, and immediately wash your hands. This is second thing. First thing is washing hands frequently. Second thing is wearing a mask, that too wearing it properly and disposing it off properly. Now, the third measure is to maintain distance from people around you. If you're an employee, if you work in an office, it is best to take a sick leave and stay at home. Because when you go to work, especially in an open workplace, there is a chance that more people will be exposed to the virus. So it is best to stay at home, stay in isolation, and maintain, if you have a private room and a private bathroom available, best to stick to one room and change the sheets, change your clothes and wash them separately, and maintain personal hygiene. Avoid mingling with other people in the family for some time until all your symptoms are completely gone. So if you're working, try avoid going to work, and try don't go to crowded places when you're having these symptoms. Keep to home and maintain distance, limit yourself to one place and maintain hygiene like we said before, and dispose of or wash these clothes and bed sheets properly. If you are using hand tissues, facial tissues, dispose them off properly because you're coughing and sneezing into them. If you're not wearing a mask, you can just use your hand so that you can cover yourself if you don't have the tissue paper available at that point. Like I said, anything that you're using, handkerchiefs should be washed thoroughly, tissues need to be disposed thoroughly. Now, when and who should go to a healthcare specialist for consultation and for possibility of testing. If you're a young person in India at this point, if you're having simple respiratory symptoms, that too milder ones, you're not having shortness of breath, you're not having any chronic conditions like diabetes, hypertension, heart disease, or cancer, or any chronic respiratory illnesses from before, like pulmonary fibrosis, asthma, any condition that is already affecting your lung status, and if you're having simple symptoms without any of these conditions, you can just stay at home and no need to go to the doctor. But before that, there is one more condition. If you have not been exposed in the last 14 days to anyone who is proven to have COVID-19 virus. So if these two conditions are met, you can just relax, stay at home, follow all the precautions that I just mentioned, and take care. But if you have any of these two conditions, first one is if you have had an exposure in the last 14 days, close exposure, that is being less than 6 feet distance in the past 14 days with any person who has been proven to have a COVID-19 virus, or who has traveled from any of these countries that have increase in cases of, like for example, China. Anyway, now currently no travel is happening from China to here. So let's limit to if anybody, if you're having symptoms and you have been exposed to a person who is diagnosed with COVID-19, then it is the time to go to a consultant, and possibly after the evaluation, you may be checked for coronavirus. So one, symptoms with chronic conditions or exposure to COVID-19 case in the last 14 days. Now, what are the responsibilities of healthy people to prevent the spread, to avoid getting infection in themselves, and to prevent the spread of infection in the community? If you're healthy, all you need to do is wash your hands frequently and maintain some social distancing. And do not go into crowds, overly crowded places, and avoid all the unnecessary gatherings, unnecessary group activities. And hand washing frequently wherever you go. If you came back from outside, or if you have touched lot of surfaces, wash your hands frequently, thoroughly with water and soap. Now the next one is, do not touch your both. This is for both sick people and healthy people. Do not touch your face with your hands. Try to avoid that. I know it's not easy. We all have a habit of touching our face. So do not touch your eyes, nose, and mouth. This is for both sick people and healthy people, especially for healthy people. Um, so healthy people, all they have to do is wash their hands thoroughly, frequently, maintain social distance, minimum of 3 to 6 feet. If you're working in a crowded place, find a cubicle, make sure you have a separate seating arrangements, reassess your seating arrangements in your office, and make sure you maintain some distance. Now, the third one is avoid touching your face with your hands. And another important measure is not sharing items. If you're sharing computers, computer mouse, or water bottles, these things are best not shared. Anything that comes in contact with saliva of other people or with hands may not be visibly contaminated but may have virus. So if you can take these precautions, healthy people can avoid getting the virus. Avoiding social gatherings is big social gatherings is one more thing. Now, what are the symptoms that you should be worried about? Like we said earlier, you may be having fever, cough, you're a young person, you do not have chronic conditions, you have not come in contact with this virus, you can relax and stay in isolation at your home. But what are these symptoms that you need to be worried about and go to a doctor? If you're developing shortness of breath on top of these symptoms, if you're developing shortness of breath, you need to go to a doctor and get yourself examined. Shortness of breath is one of the alarming symptoms So you need to go to the doctor and get yourself examined, and the doctor will assess and probably order for a test if he feels it is appropriate. Or if you have elderly people in your home who have these chronic conditions that I mentioned, diabetes, chronic diabetes, hypertension, heart disease, respiratory conditions from before, any chronic respiratory conditions, cancers, or people who are taking steroids for any other medical condition, chronic medical conditions, pregnant women, any of these people, if they are having respiratory symptoms, better to be a little bit more vigilant and have a low threshold to go to a consultant and get examined. Now, coming to the treatment part, uh, so currently, before going to treatment part, if you take symptoms, coronavirus, COVID-19, 80% of the cases, little more than 80% of cases, they are having mild symptoms. Many people are staying at home, isolating themselves, and are doing just fine. 80% of the people, symptoms are mild. There are some people, about 13 or 10 to 13% of people who are having moderate symptoms. They're being carefully observed by the doctors in the countries that has more spread, and of course in India too. So moderate symptoms, close observation, being in touch with healthcare professional, being very vigilant, so that these moderate symptoms don't become severe symptoms, and proper with proper supportive care, most of them are getting better. There are very few cases that are severe, anywhere between 2 to 5% of cases, or 5 to 7, 10% of cases that are severe, that are being admitted. Depending on the severity, they may be placed in critical care units on respiratory support and all that. From that point onwards, doctors will take care of the person, and accordingly, the treatment will be tailored. But per se, just for COVID-19 virus, there is no specific treatment that cures this condition, or this is targeted specifically for this COVID-19 condition. The treatment is mostly supportive. For example, if you have, along with this viral infection, if you have worsening of your diabetes, or worsening of your hypertension, worsening of your heart condition, worsening of your breathing status, doctors will give supportive care. Control the blood sugars, control the blood pressure, give supportive care for your breathing problems, oxygen supplementation, all these things. And if there is a superimposed infection, maybe antibiotics, all those things are called supportive measures. And if you're dehydrated, giving fluids so that dehydration will not worsen, drop someone's BP and all that. So any severe case, they're being admitted, supportive measures are being taken, and some of these people are getting better and they are getting discharged from hospitals. So, considering these, there are three levels of symptoms, and treatment is specifically tailored, advice is specifically tailored to the severity of symptoms and the person's personal health status. It is always advisable, if you have any doubt, to consult a physician. If you're in a dilemma, if you're confused what to do, it's advisable to consult a physician. Now, many people have a doubt. I have a high suspicion about that I might be having this infection. Where do I go now? Now, all over India, each state, in their state portals, they are giving a lot of information. If you follow the state portals and government medical colleges, they have the government has enabled government hospitals, and has given the testing kits and provided with all the equipment, all the necessary personnel, necessary training, and deployed, and enabled in these government facilities. Like, for example, in Telangana right now, in Gandhi Hospital, they are testing for COVID-19, and anyone who has very high suspicion, even the doctors are sending the clients there. And soon, the situation might change and more facilities might open up. One more government hospital might open up testing centers, and a few more private medical colleges, private hospitals will be probably given a go ahead for doing this testing. So it is important to stay current with the information through your state government officials and state government portals. and update information about this rather than sticking to the old information, because as the number of cases change, as the situation changes, the advisory from the government changes. um, So, what tests can be done to confirm COVID-19? Tanvi is asking this. So, if someone is having a very high suspicion for this COVID-19, that in the testing centers they will collect the nasal swab. A proper collection of the swab is important, and they will send it for a test called PCR test, RT-PCR. That is a test that is reasonably sensitive for this COVID-19 test, and that has very good specificity for this test. Um, so, in a nutshell, without using the medical jargon, it's a good test, and the centers are doing this test. Which are the centers in Mumbai? So, it is best to visit the state government portal and see which hospital is. So, Noel has answered Kasturba Hospital in Mumbai. So please check it out. Like I said, state government health portal website, it gives most authentic information. So we have talked about the symptoms of coronavirus, how a sick person can avoid spreading, how a healthy person can take precautions. Let's say a few words about cleaning your house and cleaning your office spaces, so that if any HR is joined uh, this live, or anybody who is wanting to take care of elderly people at home, prevent spread at home, they can follow these precautions. The usual surfaces that harbor these viruses are the surfaces that many people touch, like, for example, elevator buttons, electric switches, toilet flushes, and sinks, wash basins where we spit and where we wash our face and all that. So, some of these common surfaces, and if you're sharing computers, if you're sitting at one table and eating dining tables, all these places, common places, are the ones that might harbor these viruses. Thorough cleaning with a proper disinfectant, the way that is mentioned on the bottle, following the proper dilution guidelines. Some people have a habit of diluting more to avoid strong smell, or uh, 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 to avoid pollution, indoor pollution. So at this time, please follow the precautions and make sure the surfaces are cleaned thoroughly and frequently, even if they are not visibly soiled. Even if they are not visibly soiled, there is no rule that you should clean every 2 hours or 3 hours. It depends on the traffic. It depends on how many people are moving in and out. If it's a very high traffic area, you may want to clean it very frequently. If it's a low traffic area, maybe you can give a break of 4 to 5 hours. Whoever is cleaning it, the people who are emptying the trash cans, for cleaning the surfaces, it is best that they wear face mask while they're cleaning, and wear gloves while they're cleaning, and before removing the gloves, wash the gloves properly, then remove them, dispose them off. They need to wash the wrists and any area that is slightly above the glove, dispose the gloves properly, and more importantly, whatever tissue papers or cloths you're using, the person is using to clean the surfaces, they need to be disposed of properly. So with these precautions, we can avoid a heavy uh, droplet spread, and contamination of the surfaces and spread of the virus. And at this point, there is no vaccine for this virus. Many biomedical companies, they have come forward. Research is on the go. Even on treatments, some drugs are being tried and tested. They're in clinical trials. The vaccine also, it's usually a long cycle. They need to pass through certain trials, first in animals and safety in humans and all that. So we're looking at least for a few months for this vaccine, if it is possible for it to come out. if no further questions, I guess we'll close the session.